patients are very concerned about their, particularly with myelofibrosis, their fibrosis levels and whatnot. But I've also read reports where the grade or level of fibrosis doesn't really equate to a better outcome or a longer life. Can you shed a little bit of light on that?
I'm glad you brought this up, because with each new development in the field, development in terms of potential new drug, new study, we not only look at the improvement in the anemia or spleen or symptoms, we also look at these biological correlates, the fibrosis, the cytokines, the genes, expression of the genes, and we kind of desire that modifications in these biological parameters are really connected with the better overall outcome of the patients. For example, you would say, okay, fibrosis is going down, that must mean that the bone marrow will make more red blood cells. Well, this study that you mentioned is very interesting. This was a study that looked at several hundred of patients over a very long time, 5 or 6 years of follow-up. The patients that were subject to a study done way in the past, where ruxolitinib was given, or momelotinib, the one that I mentioned, and the difference between them is slight, not that much. Momelotinib can improve the anemia better, and ruxolitinib or Jakafi can do better on the symptoms, for example. They improve the spleen too. No much difference. The ruxolitinib was a little bit better overall, but these people are now followed for all these years with the bone marrows at the beginning and then 6 months. And as you say, easy to grasp, no connection between the change in the bone marrow, fibrosis for better or for worse, with improvement or worsening of a red blood cell count, or a spleen size, or the symptoms, or anything that we consider clinically relevant, not even a connection with the overall survival, which is the bottom line, right? You would say fibrosis goes away, maybe anemia improves and spleens decrease and you live longer. No, there was absolutely no connection. So arise important question. Are we actually measuring the parameters that are of clinical relevance? We all assume that the fibrosis is important, but at least under the therapy with these two agents, this is not a good marker for overall outcome of the patients in any possible way. So kind of disappointed, you want to say, from one look from one side, but you turn the other side and you say, maybe that's a good signal that gives us an incentive to look harder and find those parameters that really mean something. Fibrosis change does not appear to mean something.